friends, welcome to another episode of Daily Dose with Nurse Alice. I'm your host, Nurse Alice, and thank you so much for joining me today. I love talking with you guys, and this is a show again for you because we are talking about everything health, wellness, love, lifestyle, and anything else you guys want to know and talk about. So make sure that you follow me on social media at Ask Nurse Alice. You want to go to my YouTube channel and you want to check out every little episode there. So the way you can do that is subscribe, to like, and follow all of our videos on YouTube. And, this is a pretty special episode, guys. It's something that it's on our mind, but it's not on our minds. We're going to be talking about our teeth, dental care, especially in time of COVID. And I have the perfect person joining us today. Yes, someone who is an expert. He's had decades of experience. He's actually here locally, close to me, which I'm so glad because I can go see him. This is Dr. Sako. He works at the Dental Design in Studio City. Tons of experience, and you may have seen him. And in fact, you have seen him. He is the dental consultant for the doctors on national television. You've probably seen that show, right? Who hasn't? But he's definitely an expert in his field. I wouldn't go to anyone else. So please welcome to the show, Dr. Sako.
Hey, Alice. It's good to be here. I'm a big fan of yours as well. So thank you so much for that wonderful intro. I appreciate that.
Thank you so much. I'm so glad to have you. And I have to be honest, I haven't talked to my dentist in a while. And so actually, I'm glad to have you on because I would love to talk to you. Lots going on, little thing called COVID-19 kind of took the world by storm. And, a lot of people were told to shelter in place. Don't go outside the home except for essential activities. To not go to your healthcare provider unless it's a medical emergency or something that you definitely can't handle at home. And I think what some people have done is they've put their dental care in that bucket of non-essential things. While I think our dental care is very important because if you don't have teeth, you can't eat. Like there's so much going on, but I'm a health expert. But I'm not a dentist, right? So that's why you are the expert and we're having you on. If you could just tell us a little bit about, was that the right message to send out to people? Because people haven't been, they've been staying home. When should we be picking up our dental care? Because we're 6 months into the year now. So I'm afraid that a lot's been going on in there and I don't know what's going on because it doesn't quite present as our actual physical symptoms that we might see for other things. So Dr. Sako, tell us a little bit about what we should be doing and what we should know about our dental hygiene and care in this era of COVID.
You're absolutely right. It is a strange time with COVID, a lot of people staying home. And with dentistry, for some reason, it was categorized as non-essential. Dentistry comes in two forms. There's preventative and there's reactive. And so when we're talking about prevention, we're talking about cleanings and things like that. And sure, certainly that's not a super essential thing, but it is very important, especially when we've been in quarantine for so long, to keep up with your health, because that preventative might actually transition to reactive. And what reactive means is I have a toothache, something's bleeding, something doesn't feel right, it needs to be fixed. And there's a common misconception in dentistry that, if it doesn't hurt, it's not a problem, but that's not true, because when it does start hurting, you're past the problem. Now you need to find a serious solution. So, what's deemed important? What's an emergency? Pain periodically, we're seeing this so much in people nowadays because people's lives have been turned upside down in quarantine and the lockdown and everything else that's going on. People tend to be a little bit more stressed. There's a lot more going on in people's minds. So they'll have a toothache that might mimic something you would feel if you have a cavity, but essentially a lot more people are stressed, so they're clenching their teeth in their sleep. And when you clench, you can actually create sensitivity that you didn't have before, and it could mimic a toothache. So we've been getting so many calls from people saying, I have a toothache. And during the lockdown, we'd open up as an emergency because we do want to help people in the community if it's a serious emergency. And they'd come in, and sometimes often we'd see that there was nothing wrong, and it was sensitivity from clenching their teeth. So there is a lot of guidance that people need during this time as far as what's a dental emergency and what's not, and hopefully we could hash that out today for you.
Oh my gosh, so that makes a lot of sense. I'm stressed, I'm worried, I'm probably grinding my teeth at night, I'm all clenched up and tense, and I'm creating creating that problem, or maybe stress is, I didn't even think of that. That's I'm pretty sure a lot of people have already benefited from what you've been sharing. And that's interesting. Who makes the decision whether something was essential or non-essential? Because to me, and you can correct me if I'm wrong, but if I don't have teeth or if I'm having problems, I can't eat, I can't drink, I can't focus, I'm uncomfortable. Like I can't really function if I have a problem in my mouth.
Right. Well, I mean, one of the worst emergencies that you can experience in dentistry, and this is, an extreme, so I don't want everyone to jump to this conclusion if they feel a toothache, but if you have an infected tooth or an abscess, that could travel to your brain or to your heart, and there are some incidences where it could lead to death. This is a very essential emergency. So really, if someone, called our office during lockdown or even nowadays, and they might be a little nervous about coming in, if they tell us they have a swelling or an infected tooth and if they should come in or not, that's an emergency and they need to come in so we could take a look. The fact of the matter is emergency rooms and urgent care centers aren't equipped to handle dental emergencies. So if you do go to the ER, they're not going to be able to do anything for you and they're going to tell you to go see a dentist. So you're going to waste your time going there and then their time, their resources. So really, if there is some kind of an infection, a swelling, you need to call the dental office. You need to try to get in if you can so they could figure out what's going on and try to alleviate that infection. At the least, maybe prescribe an antibiotic or something. At the worst case scenario, and I don't want to get into the details of it, but we might have to release some of that infection out so it doesn't stay trapped in the body.
So, Dr. Sako, you just described some things of, pain, inflammation. I probably might try, an ice pack or some oral gel before I go in. Is that okay? And are there some home remedies that you actually recommend would be safe for me to do? Ooh, okay, so no aspirin. Got it. Now, now the next couple of things I want
Right.
to ask you are about different treatments that I've seen and I've heard about. So,
Yeah.
wanted to get your take on which one to do, not to do. So, fillings. I grew up in the era where we always got silver fillings. Now I'm seeing white fillings. Is one better than the other? And what should I be asking from my dentist? Okay, good thing. Cleaning versus deep cleaning. Like, I should I be opting to get like is that like getting an upgrade in my gas? Like, is that what I should be doing? Let me know. Okay, that's good to know. Because we don't know these things, and sometimes, especially since I don't,
Hey,
people
Alice, it's
don't
good to be
necessarily
here.
see
I'm a
their
big
dentist
fan of
as
yours as
frequently as they
well, so
might
thank
see
you so much for that wonderful intro. I
their
appreciate
doctor or their nurse
that.
practitioner. Sometimes there's a like, do I really need that? Do I not really need that type of thing? So a little, sometimes I'm saying a little distrust. So thank you so much for sharing this because we trust you, you guys. He knows what he's talking about. So listen to what he
Sure.
says. Some other things. So I have seen the white teeth whitening. Is home teeth
Yeah.
whitening or that charcoal stuff safe, or should I make sure I only do those things with my dentist? Okay, good. So, guys, what that means is don't just go buying all those products on Instagram trying to whiten your teeth. You actually might cause more harm than good. So, be mindful of that. And so, I know that I should be going to my dentist. How often is there a certain time frame in which I need to make sure that I see my dentist, like a wellness appointment?
You're absolutely right. It is a strange time with COVID, a lot of people staying home. And with dentistry, for some reason, it was categorized as non essential. Dentistry comes in two forms, there's preventative and there's reactive. And so when we're talking about prevention, we're talking about cleanings and things like that. And sure, certainly that's not a super essential thing, but it is very important, especially when we've been in quarantine for so long, to keep up with your health because that
Oh my gosh, that makes
preventative
so
might
much
actually
sense
transition to
to make sure that
reactive.
we can,
And what reactive means is I have a
attack something.
toothache, something's
Look
bleeding,
at
something
a
doesn't
smaller
feel right, it
problem,
needs
get
to
it
be
taken care of
fixed.
before
And
that
there's a
cavity
common
turns out to being
misconception in
something
dentistry that,
major,
if
being
it
an
doesn't hurt,
infection.
it's
Root
not a
canal,
problem, but that's not
heaven
true
forbid.
because when
Okay,
it does start hurting, you're past the problem. Now you need to
prevention
find
is
a
key.
serious solution.
Exactly. And then
So,
one other thing,
what's
I don't know if
deemed
there's much
important?
prevention
What's
with
an
this. I hope
emergency?
so. It may feel like a medical
Pain
emergency sometimes,
periodically,
but
we're seeing
bad
this so
breath.
much in people
Dr.
nowadays
Sako,
because
you know,
people's lives have been turned
not me,
upside
of
down
course.
in
Let me
quarantine
let's
and the
be clear,
lockdown and
not
everything
Nurse
else that's
Alice.
going
But
on.
I know
People
some
tend to be a
people
little bit more stressed. There's a lot
who
more going
have
on in
bad
people's
breath,
minds. So they'll
halitosis.
have a toothache that
Is
might
that just a
mimic
sign that
something you would
maybe
feel if you
they're
have a
not dental
cavity,
flossing or
but
brushing or
essentially
at
a lot more
spots,
people are
or is that
stressed, so
something
they're
that might be a bigger
clenching their teeth in
problem,
their
like you
sleep.
mentioned,
And
that
when you
needs attention?
clench, you can actually create sensitivity that you didn't have before, and it could mimic a toothache. So we've been getting so many calls from people saying, I have a toothache. And during the lockdown, we'd open up as an emergency because we do want to help people in the community if it's a serious emergency. And they'd come in, and sometimes often we'd see that there was nothing wrong, and it was sensitivity from clenching their teeth. So there is a lot of guidance that people need during this time as far as what's a dental emergency and what's not. And hopefully we could hash that out today for you. Mhm.
Yes, something you need to take care of, guys. Okay, so no, that's some good information. So don't just cover it up with mouthwash. Don't just cover it up with chewing gum or mint. Like Dr. Sako said, if you've done these things and you're still having bad breath, there's definitely something else you want to look into. So, guys, Dr. Sako has just given us so much wonderful information to help you keep your oral health in check, and that's very, very important. And what did you say, Dr. Sako? You said it is your mouth. Can you say that one more time? Their mouth is the gateway to.
Right. Well, I mean, one of the worst emergencies that you can experience in dentistry, and this is, an extreme, so I don't want everyone to
Okay,
jump to
there you
this
have it.
conclusion if they feel a
So
toothache. But
I
if
agree
you have
with
an
all of
infected
that. So,
tooth
guys,
or an
you know what? You've
abscess,
gotten tons of great
that could
information. There's not
travel
been
to
any
your brain or
copay.
to your
We're not
heart,
charging you
and
for any X-rays
there are
today or
some
anything like that.
incidences
So
where it could lead to
listen, this is
death. This is
golden
a
stuff. So
very
make sure you
essential
watch the replay,
emergency.
take notes, and
So
share this
really,
with
if
other
someone,
people. So,
called
Dr.
their
Sako, it's
office
been
during
a
lockdown or even
pleasure
nowadays, and they might
having
be a little
you.
nervous
And
about
I
coming
know
in,
after just speaking
if
with you
they tell
today,
us they
I'm
have a
going to make some changes
swelling or
in
an
what I do
infected
because
tooth,
I'll be
and if
honest,
they
I
should
wasn't
come in
seeing
or
my
not,
dentist
that's
every
an
6 months. I
emergency, and
was
they
going
need
every
to come in
year
so we could
because I
take a
thought that
look.
was okay. But
The
you're right.
fact
By
of
the
the
time I
matter
see them
is,
that year round,
emergency rooms
that
and urgent
cavity's
care
bigger,
centers aren't equipped to handle
than it
dental
should be. Right? I
emergencies.
could
So
have
if you
caught it
do go to the
earlier.
ER,
So thank you
they're
so
not
much
going to
for
be
that
able to do
information. So,
anything for you, and
guys,
they're going to tell you to go
you
see a
know what?
dentist. So you're going to waste
I'm Nurse Alice. This is
your
Daily
time
Dose.
going there,
This is
and
the
then
kind of
their
stuff we
time,
talk
their
about. We
resources.
try to keep
So
you
really,
healthy and
if there
well by
is some
talking
kind of an
about
infection, a
wellness,
swelling,
love,
you
lifestyle,
need to
our
call the dental
dental
office.
care,
You need to try
anything
to
that's
get
going
in
to
if
help
you
you
can,
live
so they
a
could
happier and
figure out
healthier
what's
life.
going on
Make
and
sure
try
to
to
follow me
alleviate that
on
infection at
social
the
media as
least,
on all platforms.
maybe
Please
prescribe
go
an
to the
antibiotic or
YouTube channel
something. At the
at
worst case
youtube.com
scenario,
forward
I don't
slash
want to get
ask
into the
Nurse
details
Alice.
of it,
Make
but we
sure
might
to
have to
like
release some of
and
that infection
subscribe
out so it
and
doesn't stay
follow and
trapped with
all
the
those
body.
wonderful things. And then also, Dr. Sako, where can people find you? Okay, and on social media, can we find you? Can we follow you? How do we become we're new fans. We want to follow and see what you're up to. You guys get the picture. You're smart. Just Google. You'll find him. So again, Dr. Sako, thank you very much. And to everyone who's watching, you guys, this has been another episode of Daily Dose with Nurse Alice. And it has been my pleasure and honor to be with you guys. And again, please make good choices. Stay informed, stay empowered, take control of your health. And until next time, guys, live well, my friends.